If you're asked to do a pupillary examination, be rest assured it's either anisocoria or it's going to be relative afferent pupillary defect. And this is how I start the pupillary examination. I start with looking at the habitus. As in general inspection, I start looking at the habitus. I immediately quickly rule out with one look ptosis or proptosis, and then I look at the neck. Neck should be free of clothes. You should look at scars if there are any present, make a note of it. Chest if that's possible, and look specifically for endarterectomy scars. That way you're ruling out any carotid artery surgery, post-surgical carotid artery or Horner's syndrome. Then look at the hands. Please do this. The hands are not wasted, indicating that this patient may not have any thoracic outlet obstruction syndrome as in Horner's. Relax. Now what you'll have to do is start with examining the pupil. Now you ask the patient to look at a distant target. Always start your examination by giving a target, never with a torch light reflex. Okay, so preferably a 6 meter distant target is what is given. Please look at the light, please look straight. Please do not look at the torch when I am going to examine you. So I start with examining the patient in ambient light, where I see if there are any discoloration on the face or any nevi, hemangioma, etc. etc. I also find out that if the patient has got ptosis or proptosis just with cursory examination. Now these are a few pointers that you will have to know. If you are too tall a person, do not hesitate to sit like this at the level of the patient's eyelids. Now if you are a short person, make sure you have a comfortable stool or a chair and sit at the eye level. I am neither tall nor short, so I am going to bend to his eye level. The second thing that you will have to keep in mind is that you should not stand directly in front of the patient and examine. The point here is that the examiner, he may not know what you are eliciting. Number two is that when the patient, if you are going to stand in front of the patient, he is not going to look at the target, and thereby you are going to induce meiosis and induce the accommodation. So your inferences are going to be incorrect. So always stand to the right side of the patient, which is conventional, and bend to his eye level. The things that you will have to talk about pupil are the size, the shape, and if he's got heterochromia, anisocoria in the bright light and anisocoria in the dark. Okay, so that you elicit by standing like this and throwing the light on the chin.